So it's 11:45. Dr. Ramirez, welcome to our Helping the Helpers session this morning. First, a few housekeeping items. All attendees are muted and encouraged to use the Q&A box to ask questions. Raise your hand or use the chat for technical assistance. You've heard this several times already, but we like to go over it again. So we do offer dental, medical, nursing, public health, and CHES and MCHES continuing education credits. To receive credit, you must complete a survey, and the survey link will be posted in the chat at the end of the session. Dental, medical, and nursing credits are offered at the session level and require a survey submission for each session. Public health and CHES MCHES credits are offered only for the full-day symposium and require only one survey submission. So we're very happy to have our speaker today, Dr. Emmanuel Mercedes. Dr. Mercedes earned his bachelor's degree in psychology and his doctorate in counseling from Seton Hall University. He is a psychologist and founder of Your Wellness Space, a Latino-owned and operated mental health company. He's also the director of organizational wellness at La Casa de Don Pedro and supervisor and trainer for the integrated behavioral health care team at Zufall. He advocates for the importance of mental health in various domains of our lives and provides actionable insights based on his over 20 years of professional experience. Additionally, Dr. Mercedes is a servant leader in various organizations, such as President Emeritus of the Latino Mental Health Association of New Jersey, board member of the Boys to Leaders Foundation, and board member of the Joseph A. Unanue Latino Institute in Seton Hall. Dr. Mercedes' interests lie in the power of organizational culture to promote wellness, and his eyes light up whenever he talks about his children. At the conclusion of this program, participants will be able to understand the critical role of self-care in sustaining their mental and emotional well-being, reducing burnout, and improving overall job performance. Recognize the signs of emotional exhaustion, depersonalization, and reduced personal accomplishments associated with burnout, and identify at least 3 practical and personal self-care practices that staff can easily incorporate into their busy schedules. Dr. Mercedes.
Thank you so much for that introduction, Dr. Ramirez. It is a pleasure to be here today, and thanks everyone who's attending. It is really an honor for me to be able to do this because my passion both for mental health and my passion also for Zufall, and I'm very happy to be able to collaborate with Zufall today and to be able to bring this presentation to a lot of other people outside of Zufall. So we have about 30 minutes, and I have to kind of be cognizant of the fact that I can only cover about so much in 30 minutes. So I'm going to try to be really intentional in what I'm going to share with you today. And before we start, let me set up my presentation, and that way we can take it from there. You've already heard what our focus is going to be. And I want to share this quote, the Zen quote that I learned, and it stuck with me from the moment I heard it. It says, you should sit in meditation for 20 minutes a day. Unless you are too busy, then you should sit for an hour. And the first time I heard this quote, it kind of caught my attention because obviously it spoke to me. As Dr. Romero has shared with you all, I do wear a lot of different hats. And one of my most important hats, I feel like, is being a dad. And each one of my hats is extremely demanding. But the reality is, I sometimes feel like the last person I'm thinking about is myself in that equation. And you probably all can relate to that. And there are many reasons why this happens. I mean, it's sort of like the nature of our profession. We are trained to look after others more than ourselves. I think the other thing that happens is that we, many of us, have life experiences that have taught us to take care of others and not so much think of ourselves. And so self-care, although it sounds like a very simple term or like a concept that most of us may be familiar with, the truth is it's a lot more challenging because to put it into action, because many of us actually don't have it as a second nature kind of like, ability or capacity. If anything, we know it's there, but we have a hard time tapping into it. And based on this Zen proverb, the idea is that the more that you have on your plate, the more demanding that your time is, the busier your lifestyle is, whatever that may be, the more responsibilities you have on your plate, right? The more time that you need to allocate to paying attention to yourself, right? And that is, if nothing else, if you can walk away with that recognition that the amount of work that is demanded for you, the amount of effort that is demanded for you requires that you also balance that out with even attributing or putting just as much time when it comes to taking care of yourself. So we already went over the objectives, so I don't have to read this to you once again, but they'll be there. If anybody wants to get a copy of the slides, I'll be happy to share them with you. Although my points in the slides are sort of minimal just to carry forward the conversation. So I find that this is something, sort of a metaphor that is very useful for a lot of people, especially because of the work that we do. You probably may agree with me on this, that you feel extremely lucky. Every single one of us who is in the helping profession, every single one of us that feels like that we get to help the world heal, right? Through our skills, through our knowledge, through our experiences, our expertise. We are extremely lucky because we are literally being paid to make a positive difference in the world. And I always sort of joke around. I say this, and sometimes I have to be careful who I say this to because they may actually take me way too seriously. But if I didn't have to pay bills, I'd probably do my work for free. That's how much I enjoy doing the work that I do. That's how much I enjoy helping others. And truth be told, I have not yet met a single person that is in this field who doesn't feel the same level of passion, who doesn't want to care for others, and doesn't feel fulfilled by the capacity to be able to make that impact in other people's life. And so if we were to think about our gifts or abilities, and we will call that sort of our light, right? We are blessed that we get to share our light with the world. But that same light that brings light into the world, that same, let's say, candle that or source of light that brings light into the world, inevitably also casts a shadow, right? And there are many ways that you can interpret this, but the interpretation I'm going to share with you is that the work that we do is also inherently both our source of fulfillment and inherently also our source of stress. That when we are helping other people, immediately at the same time and without being able to avoid it, we are also engaging in levels of stressors that cannot be avoided, in levels of stresses that affect our emotional well-being, can affect our physical well-being. They deplete us, right? And not necessarily in a negative way. I'm talking about, you wake up in the morning as early as you could. In my case, usually I'm up by 6, and I have a list of things that I want to accomplish for that day. And I feel fulfilled in being able to do that. But by the time that I get to bed at night, even before that, when I'm interacting with my kids by like 7, 8 o'clock at night, I'm putting them to bed, the exhaustion is real. And it becomes palpable because I can tell when I'm already reached a point where I can no longer, entertain conversations or, perhaps maybe beyond not having a conversation, getting annoyed by interactions with some people. Our little kids can be a little rambunctious sometimes, right? And that is the result of having done so much good throughout the day, right? Having shared my life with so many different people, is that I find myself exhausted. And I know for a fact that this is the reality for many of us. And it's not something that we can eliminate or take away from our work. And that's just on the basic of just like the simple everyday work that we do, not to add to that, having to deal with maybe our own personal traumas or the traumas of other people, maybe some of the cultural, societal dynamics that may be at play, the challenges that may happen within a certain organization, politics of all kind. Well, the truth is, by the time that we're done, we all are really, really tired at various levels, but we are still in love or enthusiastic about doing what we do. It doesn't mean that when we go to bed, uh, we don't want to wake up the next day and do this work all over again. Uh, but it does take a toll, right? And what becomes then important is not necessarily to cast away the shadow, but simply to incorporate it, to understand, well, if the work that I do is so meaningful, but it also casts a shadow, what is it that I can do to account for both so that I am able to maintain and continue to do this work, right? Not simply sort of burn out or reach a point of complete exhaustion, but that I can actually do this for as long as I continue to love it, right? So these are some of the byproducts of the work that we do. We're talking about physical strain, right? Just simply being physically fatigued. Sometimes the number of hours that we put into our work, it's more than what we had maybe anticipated, or even if we had anticipated, the energy that it requires from us, both in terms of our physical and our cognitive processes of all the things that we are doing, literally feels like exhaustion. There's obviously emotional and mental health challenges that come from our work. I always remember when I was first starting in my career and I was being put in a situation that I was asked to provide services in an oncology unit. And in a matter of 3 months, I started experiencing anxiety. I thought that I was having medical symptoms of my own. The work was so taxing and so overwhelming that at some point I actually needed to go seek my own mental health services. And the reality was it was a reaction that I was having to the normal stresses of the work that I was doing. And actually part of the inspiration for why I do the work today, because at that particular time, when I expressed my concerns, it felt like as if it was minimized. They were not necessarily taken too seriously, but they were super debilitating for me. I mean, I literally felt like I was having at one point a stroke, when in reality, I was having is a panic attack, or maybe not all, but you get my point. Overwhelming, all resulting from my experience in our workspace. Obviously, this also can translate into social and relationship impacts of different kinds, right? So you're talking about either conflict at work or it's straining the relationships outside of work, right? When my firstborn, when my first son was born, I was working in a hospital setting in which I was putting in crazy amount of hours, in addition to having to commute an hour plus every single day each way. Well, what that translated to was having sort of like a distant, not as close relationship with my son. And that's something that actually continued to impact for many years after that. It actually required a lot of intentionality around rebuilding my relationship with my son, because although we had a connection, there was a distance that had been born out of the physical distance that I have from him, and an emotional distance out of the physical distance due to the work experience that I was having. So that can also happen, right? There are workplace challenges. Just the nature of the work we do can be very difficult and can be at times overwhelming. And we can talk about, ethical dilemmas that may arise as a result of the work. And for many of us, and if we are really honest, this probably happens to all of us at some point or another, we may find that we don't necessarily have a really good work-life balance, right? And I have like a love-hate relationship with this particular word, because what is balance exactly, right? But what we're talking about is like a mixture of work and life that works for you, right? That allows you to feel fulfilled, but also energized, not overwhelmed, at least not all the time, in which you're able to attend to the areas of your life that are important to you. So I want to use this particular analogy, right? The analogy of a pit stop, right? Uh, Most of you probably are familiar with car races, even if you're not sort of a fan. And the idea behind a pit stop is that, you know, they are there so that you can refuel, that you can change your tires, you can look at your systems to make sure they're operating. And believe it or not, anyone who actually misses or avoids taking their pit stop puts themselves at great risk, because a flat tire can go off and completely derail your race. You may run out of gas. And I think that is something that we can all, in one way or another, relate to. Or we can have some level of dysfunction that uh, impedes us from being able to actually be at our optimal capacity. I want to share a quick story with you about one particular resident that I worked with when I was working in a particular site. This was a third-year resident, and he was a psychiatric resident. He was working in an inpatient unit. And as you know, the amount of work and the demand in terms of the time can be extremely exhausting for residents in particular, right? Uh, we already know that there's even data and research that shows that, you know, the working conditions for residents sometimes is not even necessarily a healthy one, because there's a lot requested from them, which doesn't necessarily provide for a good balance between, you know, their physical, mental health and the work that is expected to be delivered. Well, this young man apparently, whenever he was under a lot of stress, he experienced some kind of word near his lips. And he was aware of this. He knew that every time he was under a lot of stress, he would get these words. And he, you know, he had already dealt with that in the past. It was nothing that, you know, that was sort of like scaring him, or he wasn't concerned about his health in that regard. But he didn't feel like he had a time to actually go to the medical doctors to get himself checked out and get a prescription for the cream that he usually got in order for him to be able to take care of that. For him, he felt just uncomfortable that people will see him with that, even though he knew it wasn't contagious and it wasn't something that necessarily would prevent him from doing his work. But he wanted to take care of that. And in a moment of sort of like sort of faulty thinking, he said to himself, well, you know what? I'll just order the cream for one of my patients and then get that, and then go see my doctor later on and replace it. So that way I can, you know, take care of myself right away, but not necessarily take anything from the patient. Well, as you already can imagine, that all kinds of flags are raised in that kind of situation, right? It was not an ethical professional behavior on behalf of this student. And he got caught. One of the nurses saw that there was a cream that didn't correspond to the patient, and that was being put in the order forms. And there was a lot of confusion as to why this was there. And eventually they figure out what happened. And the resident was actually facing potentially being expelled from the residency. It was extremely overwhelming for him. All his fellow residents felt the anxiety of seeing this young man almost facing being kicked out of the program. Um, he was so regretful for making that decision. And because I was one of the supervisors and I work with them closely, I kind of like check in with him just to see how he was doing as the investigation was going, and they were trying to determine, you know, how to proceed. And his response felt sort of like innocent, and yet sort of said so much about his mental state. He essentially said, I was so overwhelmed with work, I didn't want to call out. I didn't want to take sick time for myself. I felt like what I was just doing was just like a quick solution for something. I realized now there's an obvious mistake, but I wasn't thinking clearly. And this is kind of like sort of like the point that I want to drive home. I mean, this obviously there's layers to this story as I'm sharing with you. But the thing about this is obviously he was not thinking clearly. And not thinking clearly is one of the biggest concerns, right? Whenever we are not taking care of ourselves, is not only not thinking clearly, is that we are not able to give the best of ourselves to our patients. And ultimately, not only to our patients, but to everyone that depends on us. Just like the crew from a race car team, right? Every person that has been working to make this possible depends on every person in the team taking good care of themselves. Because it just takes one of us to fall through to affect everyone else around us. So self-care is actually the best way to ensure that we are not only caring for ourselves, but that we are able to be there for our loved ones, be there for our team members, and certainly be there for our patients, the people that we provide services for. So I came up with this cheesy way to think about, well, what are some things that I can do to actually care for myself, right? Now, right now, I want you to pay close attention to this. If for whatever reason you've been distracted on your phone, had to respond to emails, I don't know, there's noise in the background, this is the time where I really need you to pay attention, because I want you to walk away with something that is practical and that you could put into action. And I'm going to tell you the kind of degree of attention that I want you to pay. My 9-year-old is who I call at home like the attention police. He tells you a story or starts telling you a story, and the moment you're not paying attention, he calls you out on it, right? He literally calls that you're not listening, that you're not paying attention, that you're doing that thing where you're looking at me, but you're not really paying attention. Yes, I'm guilty of that. I know. I'm working on it. So this same 9-year-old, though, tells me a story, and when I can get it right and I pay attention, I find that that is the most rewarding of experiences. It may not be the greatest story, but just to see his enthusiasm sharing that story with me, it just provides me so much value in life. So I've sort of set up the idea of like why you need to take care of yourself. The idea that, everything depends on our capacity to be able to be present mentally and physically, right? That it's unavoidable, right? You cannot prevent yourself from having to deal with some of these negative side effects, quote unquote, of the work that we do, right? And that there are other factors that are going to contribute to it, so that the wear and tear on us is going to be real. So what do we need to do to actually improve or increase the chances of avoiding some of the negative impacts, right, that come from the work that we do? So this is the cheesy part, right? I call it sleep, eat plus Dr. ABC. This is so that you can remember it, right? This rubric. And doctor stands for daily routine. And the reason I say daily routine is because I need you to understand that our habits are going to be more important. What we do on a daily basis is going to have a greater impact on us than anything else that we would do, sort of like in a large, kind of grandiose gesture. So if you think about this for a second, if you run 10, 20 minutes a day versus if you run 2 hours a day, a month, which person will be most fit, right? I know, the person that does it on a daily basis, even though they're only doing it for a shorter amount of time. So when it comes to self-care, the goal is not to have grandiose sort of gestures, is to actually do something every day if possible, right? And so your daily routine, I would want you to, one, already accounting for sleep and eat, right? Because it's sort of like the bare minimum. I want you to think about A, being awareness, B, being body movement, and C, being connections. Now, I'm basing this on the research that shows that sort of like what leads to our sense of happiness has a lot to do with sort of three primary areas. The one area is for us to have close relationships or connections to family and friends, hence why I put their connections. And then the other two areas are, one, to have meaningful work. And my sense is that if you are a healthcare provider or healthcare professional of any kind, you are every single day encountering opportunities for feel like the work that we do is meaningful. So it would just be a matter of then paying attention or being aware. And then body movement is because we cannot ignore the relationship between our bodies and our minds. And so it really is important to know that you have to kind of work on both sides in all fronts on an ongoing basis. So for awareness, this is my practical suggestion, right? Take 10 minutes a day to engage in an activity that increases your self-awareness. Now, for some people, that may be meditation, which is what I personally do. For other people, it may be journaling. It may be like a solo conversation, literally walking and talking to yourself, or, when you're doing your hair or, I don't know, getting dressed, those moments where you are maybe alone and you have 10 minutes, right, to have a conversation with yourself. It's just to check in. It sounds a little weird, but it's not so much. We actually do it all the time, but we do it unconsciously, and we're listening to negative voices or having negative conversations with ourselves. This is more a checking in. How am I feeling right now? What's important for me today, right? Being present in this particular moment and finding what works for you. But start with just simply 10 minutes a day. The second is take 20 minutes a day to move your body. Now, for different people, this may look very differently. 20 minutes could be 20 minutes running, 20 minutes walking. It could be spending at least an average of 20 minutes, like getting up from your desk, walking around in your office but not sitting steady the entire time, right? I actually have a client who came up with the idea of 20 minutes dancing. And it actually works for them. In the morning, they put music on and they dance for 20 minutes. I don't know if you have the inclination to do that, but I actually kind of like that, right? The concept is you get your blood flowing. You actually feel energized by your own movement. And we know that actually then contributes to a feeling of wellness, both physically and then on the emotional end as well. And then the last one of the Dr. ABC is taking 15 minutes a day for a meaningful connection with loved ones or friends. Now, I told my parents that I shared this on the previous presentation that I did, and they're like, oh my God, I can't believe you say that. So here I am, and I'm going to share it again. Just don't tell them. Okay, good. We're on the same page with that one. So I come from a family of lifelong connection neglectors. And what I mean by that is, like, any of us can go several days, several weeks sometimes without really being in touch with the other. We love each other, but there are friends that I haven't talked to in months. It's just sort of like crazy that that's the way we operate, but it's the way that we operate. And I became aware that there were certain relationships in my life that I was just simply neglecting, and that didn't feel like I wanted to continue going in that direction, especially when I learned that my sense of happiness and fulfillment is also positively correlated with, my sense of connections to other people. So we started this kind of like little tradition with my parents. We created a chat, like a group chat on WhatsApp. And every morning, like around 9 o'clock in the morning or so, sometimes a little bit earlier, depends on what time we're dropping off the kids. We actually just call each other up through the group chat, right? typically I'm driving, so I put them on the speaker. And the words that come out of my mouth every single morning are, tell me what's going on so we can pray about it. Or what's the gossip for the day so we can pray about it. And of course, then my parents, say, you're always looking for gossip. And then they tell me the gossip of the day. The cool thing about it is that we actually spend about 15 to 20 minutes every single day checking in. It's not anything out of this world, nothing crazy or, out of the ordinary. It's just simply an opportunity to connect with people and have meaningful conversations of some sort. How are you doing? What are you up to? What's been going on? Oh, you're doing a presentation today. Oh, that's great. What are you going to be talking about? And then, everything else is happening in society. We kind of like all included in these 10, 15, 20-minute calls. And that's actually enrich our conversation. Even when there are parts of our relationship we're still working through as a family. It also has carried over to other relationships, because now I find myself sort of giving 15 minutes of kind of undivided attention to other relationships. And that's actually something that I do with my sons, especially with my oldest one, who I told you is an attention police, right? Is the idea of taking 15 to 20 minutes so that whatever we're going to do this 15, 20 minutes of just undivided attention. Now, what I just shared with you was 10 minutes of self-awareness activity, 20 minutes of physical activity, and 15 minutes of connections with other people. And these numbers are not necessarily, picked at random. It takes about an average of 12 to 13 minutes of self-awareness activities to kind of like have a positive impact on, your level of attention and concentration and your awareness of your emotional state. So there is, we're saying 10 to get you started, getting closer to like 15. And then a physical activity of about 20 minutes of rigorous activity can be helpful for your, for your physical health and obviously for your emotional health as well. And then there is research that says that about 15 minutes a day of, emotional connection or intentional connection with people is sufficient to establish or maintain a bond with that individual, particularly with your children. So in an hour of the 24 hours that we have in the day, we can technically and practically do something to improve our experience of our physical and emotional well-being. And you know what? Given the value that you bring to the world and the light that you're sharing with others, I think sharing 1 hour of your life or taking 1 hour of your life just for yourself so that you can take care of yourself, so that then you can take care of other people and continue to do the amazing work that you do. I think that's a good trade-off. Wouldn't you agree? So I'll finish with this statement. Do the best that you can until you know better. Then when you know better, do better. The hardest part about this is not that somehow I'm sharing something you already didn't know. Let's be real. I'm sharing things that you probably are fully aware of. If anything else, this serves more like a reminder to take care of these things. But the hardest part about it is that once we know or we're reminded to do something to take care of ourselves, especially when, it is so important and so meaningful, it's actually breaking the habits of not doing it or moving away from the habits that we already have in place to sort of establishing better habits, right, that are going to promote our physical and emotional well-being. So this is the challenge for anyone and everyone listening to this right now. Right after this, and as soon as you get your next break, be intentional about identifying when you're going to take 10 minutes for self-awareness and put it in your calendar, 10 minutes or 20 minutes for physical activity and put it in your calendar, and 15 minutes for connection and the people that you're going to be connecting with and put it in your calendar. The idea is create the habit that you want to actually build out the daily routine that you want so that you can then have the life, the quality of life that you want and need for yourself. So with that being said, that's going to be all that I'll share with you today, and we'll take some questions.
Wow, 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 Dr. Mercedes. That was amazing. We have a lot of love in the webinar chat. There's a love, love, love this. Thank you. This is great. Some people have actually have chats already with their kids and grandkids. Great ideas. Really actionable, really amazing. Thank you so very much. There are a couple of there's a couple of questions in the chat. One was a comment. Again, thank you for sharing your story. The power of storytelling is amazing too, because it really resonates with how we're feeling. Oh yeah, I've been there. So it really she says it truly or who, I don't know who it is. It really truly resonates with my work and demands in the past and again currently, because again, the work life balance is one of the things that we struggle with the most. So the second question is, how do we share with our teams or supervisors that we're not okay without feeling like we would be judged as incompetent or weak? This is something very common in clinical practice and in a lot of professionals. What are the signs to look for that our management are safe spaces? Wait, what are the
Mm,
signs to look for that our management are safe spaces?
excellent question. Right. So, uh, coincidentally, we're going to be speaking a little bit about this later on, but I'll just share real quick a snippet, right? The concept that we're talking about here, when you're talking about our management, our safe spaces, is psychological safety, right? And psychological safety is something that requires a collaboration between both the employer, the management, and the employee. And there is some risk taking. It's sort of like having the initial conversation of like, hey, is it okay or is it safe for us to talk about our emotional state or our emotional well-being? Now, what you'll notice, and this is true in our organization and many other organizations that I've seen, that the leadership is actually taking initiative to actually be the ones spearheading this conversation to let people know we are trauma informed. We do care about your well-being. We are taking initiatives to actually make sure that you are okay when you're doing this work. And so if you have not had that conversation with your management, right, you may not want to start off by saying, hey, I'm having a very, very rough day today, but you may want to simply ask, hey, what is the take here? What is the take when we talk about, emotional well-being? Do we have a space for that? And get a sense of what is being said or shared with you. And I say this fully cognizant of the fact that there are certain spaces where it is not safe to share how you feel because people may not respond the way you need them to respond. And so you want to kind of like gauge, from your manager, if I tell you that I'm going through a rough time, what are you going to do about that? How are you going to respond to that? But in places where the sort of like the intent to do better is already sort of in action is there, you'll hear things like trauma informed care, and you'll hear like we want our staff to do better. And that translates into, well, listen, I appreciate that you want us to do better. I need to share with you that I'm struggling with this. You have to initiate that conversation. In some spaces, and for anyone who's a manager in the call, right? The idea is, well, you should initiate that with your team. Is to say, hey, just so you know, if anyone here is not doing well for whatever reason, please uh, talk to me about it, or let's have a conversation, and then maybe even be proactive about bringing up some conversation. Hey, real quick, I just want to remind you, burnout is a thing, moral injury is a thing, stress is a thing. So how's everybody doing today? And asking the question, and then giving the space for people to respond.
Very good, Manny. This is great. People are giving you advice. They want you to do podcasts to motivate people. They're giving you more work.
Yes, that sounds like more work to me. Thank you, though. I appreciate it.
Again, excellent, excellent, very positive. I have another question, and this one is a little bit more in what we are right now. We're living in very challenging times, and that has found its way into some of our workspaces or in some of our family spaces that then we invariably bring into work, creates conflict or stress that leads anxiety. How do we handle that while also validating our feelings?
Yeah, that's that. Thank you for the question. So in anticipation to a question like this, I was thinking about what do I say, right? Because there's so many different ways in which this can go. Um, and I'll just briefly share sort of like my own personal experience. When I have conversations with my family about things like politics or religion, it is never not conflicting or some level of, friction. And we end up kind of like, sometimes losing focus on, certain things. First of all, we are entitled to our perspectives and our feelings about it. Uh, but we also have to recognize kind of like the boundary in which we cannot sort of force anyone to feel or think the way that we do. So you have to kind of give space for your feelings while also providing space for the feelings of others and the opinions of others. And that can be tough because we can be very passionate about our perspective on things. But, thinking then about like recent times, I was in a meeting where I was pulled, where people are having like, I was consulting for a team where people are having reactions to the elections. And because of my profession and sort of like my nature of in terms of my personality, even if I don't agree with you, I can generally have a conversation. But I had to remind myself that not everyone have that same ability or may be able to be emotionally in that same space. So if recent times have been particularly challenging, first I would say take a moment to sort of like be in tune with how you're feeling and give yourself permission to actually feel your emotions and maybe even find spaces where you can address those emotions in some safe manner. I have a private practice and that allows me to have conversations with people, and this past couple of weeks there's been a lot of those conversations taking place. But these conversations can also happen with close friends or families that you feel that you're aligned with and you trust. Uh, and then as you are acknowledging and being aware of sort of like your feelings and your sentiments and sort of like how that's impacting you and maybe other people's emotional experiences, at some point you have to try to then reconnect back to your values. I can't tell you that it's going to happen right away, but you have to take time to reconnect to your values so that you're responding based on what is important to you and what guides your like guiding principles in your life, rather than responding or in reactivity to what's going on around you, because that will make it difficult. So I would say focus on validating, giving space to your feelings and emotions first, and then once sort of like those feelings and emotions settle, return back to your understanding of what's important to you. What are your guiding values, your guiding principles, right? And for me, for example, like I'm committed to serving my community. I'm committed to serving my family and providing for them, both emotionally and financially. And sort of like I'm sort of bringing myself back to those ideas, right? And there's a lot more, but just wanted to give you a quick example.
This is great, really helpful. And sort of going back to the A in your just remind about your awareness and what is it that then you can do in order then to go ahead and make the connection that is appropriate connection at that time. Well, we're almost running out of time. There is a little bit more, there's still information going on in the chat. Again, a lot of discussion about how people have self-care, questions about what if management does not care about how you feel. And that's something that's, it's real. I'll give you a moment to
Yeah, so that's always going to be a challenge because there's obviously some power differential, and it requires sort of taking some sort of initiative to kind of like discuss it with the people you're working with, and then escalating things as necessary. Um, and obviously no one wants to see a good employee leave an organization, but if you're in an organization that doesn't care about your well-being, um, then either the organization has to change or the manager has to change, or you yourself can make a decision to leave. And I say that, obviously I would prefer that the system changes, because the other people that are left behind, well, they have to still deal with that. Uh, but the truth is, if a system doesn't want to help, or is not willing to help, then it's our responsibility to look after for what works for us as individuals.
Thank you so much for that, Dr. Mercedes, and everyone who attended. Thank you so much for your attention. This is wonderful. Please remember to take the survey in order to receive your credits. And now you are going to be automatically routed back to the lobby to be able to join the expo session. Take care, everybody.
Take care. Bye-bye.